So the question on when to even start these discussions with patients, how early, sorry, the discussion on how early you would talk to the patient. I'd have to say that since I treat both children and adults, I sort of have different discussions and with whom, because in children, the mothers are often asking me, is this a medication that she'll be on for the rest of her life? That's often a question. That's for both males and females, by the way, the parents are asking. But particularly, does this therapy impact my child's ability to get pregnant, or would she have to stop it during pregnancy? I often say to them that what I'd say to when I have a woman who's asking me that same question, fast forward 12 years or 20 years from that discussion, I'll say the same thing, that whatever therapy I'm going to prescribe for you today, you're going to be able to continue if you get pregnant tomorrow. And if you are close to thinking about it, for example, a patient is on methotrexate plus an anti-TNF. I will stop the methotrexate 6 months before conception, continue the anti-TNF. If they're on thiopurines plus an anti-TNF and they're really durably well, then I'm actually going to have a discussion. You don't need to be on 2 drugs. You can probably just be on 1. Because even if I'm not concerned about malformation risk or risk, I'd still like the mother to feel confident and comfortable that we're minimizing exposure to anything. And a more recent study showed that, particularly with TNFs, is the baby is not at, the mom is at risk of getting flares if they stop, but there's also an increased risk of maternal infection in women who were exposed to TNF, not controlled for a lot of things like steroids and how active their disease is, which I think is more relevant, but I do want to put it out there that there's data out there that talks about how you counsel and whether you stop meds. And I'd say that every stage of when you see a patient and you're starting a new therapy and it's a female patient, I think you should assure them that these drugs are safe during pregnancy, or address the fact that even in 5 years from now, you may be on a different drug, but I want you to know that if something changes and you want to have children in 2 years, or you finish school earlier and you want to have kids, whatever, again, it's an ongoing dialogue, then I explain to them that we'll adjust it accordingly. But whatever I'm starting you today, you're going to be able to get pregnant on, unless I'm starting methotrexate. I think that's the only one that I would counsel differently.